Good afternoon. I'm joined today by Professor Stephen Powis, National Medical Director of NHS England. The average number of new cases each day is now 22,524 compared to 22,398 a week ago. There are now 14,196 COVID patients in hospitals across the UK compared to 12,406 a week ago. 1,219 patients are now in mechanical ventilation beds compared to 1,142 a week ago. And sadly, another 595 deaths within 28 days of a positive test were reported yesterday. The 7-day average daily number of deaths each day in the UK within 28 days of a positive test by date reported is now 375, up from 295 a week ago. Our thoughts are very much with the families and loved ones of those who've lost their lives, which is a reminder to us as to why we are taking the action we are to stop the spread of this virus and ultimately save lives. Today, we're also reminded about the vital importance of fighting this virus to protect our economy. Whilst the economy grew by 15% in the third quarter, it slowed in September and remains 8.2% below where we were in February. We in government understand acutely the human impact this statistic represents. It's jobs, livelihoods, and families affected. So we will continue to support businesses now and as they recover. The government has provided unprecedented levels of support for businesses over the past 8 months. To date, that represents over £200 billion in support. This is one of the most generous and comprehensive packages of financial support provided in the world, which the International Monetary Fund has praised. Just this month, we have announced an extension of the self-employed grant scheme to March next year, an extension of the furlough scheme at 80% until the spring, cash grants of up to £3,000 per month for businesses in England which are required to be closed due to this month's national restrictions. These will benefit 600,000 business premises. And I can confirm today that we will be distributing £2.2 billion to local authorities tomorrow to allow them to make these vital grant payments to the businesses which have been affected. All of these measures are designed to preserve jobs and help businesses stay afloat. Today, we have also announced that more than 19,000 jobs have been created so far through our Kickstart scheme. These jobs are spread across the country and in a variety of sectors. I know how hard this job market is, particularly for young job seekers hoping to enter the workplace for the first time. The Kickstart scheme is a ray of hope for young people, and I want to thank all the businesses which have stepped up to participate in this scheme. I speak to businesses every day, and I can see that despite the tough times, they are determined to soldier through this. Through sheer hard work, innovation, resilience, and invoking a real community spirit across the United Kingdom. For example, in Aberdeenshire, Brewdog has made hand sanitizer to protect our frontline NHS staff. In Belfast, Axial 3D has helped develop thousands of new ventilators. In Surrey, Carousel Lights have adapted their manufacturing processes to produce sneeze screens for GP surgeries, pharmacies, and care homes. In Caerphilly, Transcend Packaging has converted production lines to create PPE, almost doubling their workforce in just 4 months. Because despite the government support, and when it comes down to it, it is you who are keeping the country going. You who are powering our economic recovery. Just as our brilliant scientists and researchers are powering ahead in the race to discover a safe and effective vaccine. A little over 6 months ago, I stood here and announced the creation of the Vaccines Task Force, a team of industry experts, scientists, and civil servants with one mission: to secure a vaccine to beat down this virus. Since then, we have secured access to 350 million doses through agreements on 6 of the leading vaccine candidates in the world. The task force has demonstrated how we can work together at pace. Business and science, the NHS and local communities, together forging a path out of this predicament. But although this week's announcement on the Pfizer-BioNTech vaccine is potentially very good news, we still have a lot of hurdles to overcome before we can be certain of its safety and efficacy. So we must ensure that we continue to follow the guidance, to protect our loved ones, our families, our friends, our communities. Because the virus is still there. It is still a danger. So we must not lose our resolve now. We must keep focused to protect the health of the nation and the health of the economy. Working together, supporting each other, we will get through this. We will come out the other side, stronger, more resilient, and more united. I'm now going to pass over to Professor Powis to take us through the slide.
Thank you, Alok. I'd like to start by thanking all of you who are following the latest restrictions. I know it's not easy, just how difficult it is, especially the second time round. But sadly, the number of patients in hospital with coronavirus is still rising, as is shown in the single slide that I'll be showing today. You'll have seen this slide before. We've updated it to yesterday, and it shows COVID-19 hospital inpatients in England. As you can see, over the summer, those numbers were low, but as we have moved into the autumn through September and October and into November, numbers have been rising. Indeed, when I appeared here at a press conference exactly 1 month ago, on the 12th of October, that number stood at 3,827. But as you can see, 1 month later, yesterday, the figure is just above 12,700. As we know, that number will unfortunately continue to rise if infection rates continue to increase in our communities. And sadly, while treatments and therapies have indeed improved, more infections inevitably also mean more deaths and more people suffering from the debilitating effects of long COVID. Now, this week we've had the extremely encouraging news concerning a potential COVID vaccine, and in the NHS, we're preparing to deliver that vaccine. It might feel like the cavalry is coming and we can relax about the restrictions, but it's vital that we continue to do two things that will reduce the spread of the virus and help save lives. Firstly, we can all personally limit transmission by washing hands, wearing masks, and keeping an appropriate distance from each other. That is what the restrictions are designed to do. We know these measures work, so don't stop now. Keep going, because frankly, every time you wash your hands, you keep your distance, you wear a mask, you could be preventing passing the virus to a loved one, to a neighbour, or to someone you work with. And secondly, of course, I'd urge everybody with symptoms to come forward to get tested and to self-isolate when they come into contact with anyone who is tested positive. Both these measures will slow the growth in infections that will inevitably lead to increased hospital admissions and sadly increased deaths. There is hope on the horizon with a vaccine, and of course that is welcome news. But the vaccine's not here yet, and it will not help us in this second wave if infections continue to rise. That's why it's vital that we all continue to follow all of the guidelines. Now, getting a vaccine so rapidly to this point, as you've heard, is a major scientific achievement. And I think it's an unprecedented achievement. And personally, I applaud all those scientists, everybody who has been involved in the development and the continuing development of the many vaccines that are being developed. But today, I'd like to end by especially thanking everybody who has taken part in the trials that have been ongoing. Whether it's the recovery trial here in the UK, which has helped the NHS show the world that dexamethasone is a successful treatment for COVID, or those who've taken part in the clinical vaccine trials for COVID and indeed continue to do so. All of you who have done this have selflessly put yourselves forward for the greater good of all of us. And your actions, I'm absolutely convinced, will ultimately help save lives. So a big thank you for me and everybody working in the NHS. Alok.
Thanks, Steve. I think we'll now go to questions from the public. I first we have a video from Chris from Reading.
Good evening. In light of the Pfizer and biotech announcement of a development of a vaccine that is 90% effective, can the government now inform the public how this and other vaccines will be rolled out across the UK in 2021? Thank you very much.
Great. Well, thank you, Chris, for that question. Of course, incredibly pertinent at this point, as we've heard about the developments on the Pfizer-BioNTech vaccine. We have the Independent Joint Committee on Vaccinations and Immunisations, which decides in terms of tiering, in terms of who will get access to the vaccine first. I'll ask Professor Powis to perhaps talk also about how we're going to deploy this. But I think that the key issue is making sure that those who are most at risk, most vulnerable, who get access to the vaccine first. I think very, very many people across the country will absolutely understand that. It is about protecting the vulnerable, about protecting people's loved ones. But Steve, do you want to add anything?
Yes, so as I've said, Chris, a huge achievement to get to the point this week so quickly in this pandemic that a potential vaccine is available. Clearly, we need to see the data from the clinical trials, the usual regulatory mechanisms that are gone through for any new drug or new treatment will be gone through once they are available, and then it will be the task to deploy that vaccine. So, of course, in the NHS, we have been working incredibly hard to prepare ourselves for this. We are very good at vaccine programs. We undertake flu vaccination every winter. Indeed, we are well into flu vaccination time of year, and our GPs and community pharmacies have been doing a tremendous job ensuring that those that need the flu vaccine get it this year. So we have the systems in place already to build on to deliver a flu vaccine. So our general practitioners, our community pharmacies, but also we will be looking at other channels, other ways of getting a vaccine to people. So that might be vaccination centres, for example. We will be saying more about this in the weeks to come once we know a bit more about the vaccine, about the way it needs to be handled, once the regulatory approvals have been gone through. So we will set all of that out, but we are working incredibly hard, and I'm confident the NHS will be up to what will be a huge logistical challenge. But we have done this. We've done this with flu every year. We will be able to do it with COVID.
Steve, thanks very much. I think we now have a question from Laura from Sheffield. So Laura from Sheffield asks, if the current restrictions end on the 2nd of December, do we go back into the area tier we're currently in, or will it be reassessed? So Laura, thank you very much for your question. We've made it very clear that the national restrictions will come to an end on the 2nd of December. And then we will move back into the tiering system. I think what's important right now is exactly as Professor Powis has said, that we observe the rules, we observe the guidance, and do the basics to protect ourselves, wash your hands, cover your face, maintain social distance. And of course, as we get to the 2nd of December, the Prime Minister will set out more details. But the restrictions, national restrictions, will be coming to an end on the 2nd of December. Thank you for that question, Laura. I think we now go to questions from the media. And I think the first question is from Sophie Hutchinson from the BBC. Sophie.
Hi, questions for both of you. Professor Powis, to start with, how concerned are you about this very dramatic jump in the number of COVID-19 cases that we've seen in today's figures? Do you think these people were infected just before the lockdown? And do you think it was a mistake to allow a number of days between the announcement of the lockdown and its actual start? And a question for the Business Secretary. Can you be sure that the disruption from Brexit will not interfere with the supply chain for the vaccine?
I'll take the first point then, Sophie. I think the first point I'd make, of course, is, as you know, it's important to look at the number of cases reported over a number of days and not just take one day in isolation. And as you've heard earlier, the 7-day rolling average is just above 22,000. So important not to focus just on a single day because of the way test and trace works. The second thing, of course, there is other data to look at. The Office for National Statistics has been looking at COVID infections in a segment of the population every week. It will report again, I'm sure, tomorrow. And the REACT study, which is a similar study from Imperial College, has been doing the same. So I think, again, don't look at a single day and don't look at a single data set. Those data sets in particular are going to be very important because they're not affected by some of the things around test and trace, around who comes forward. The ONS and the REACT data sets look at people essentially randomly selected throughout the population. But it's clear that infection rates have been going up, as I've shown you, and what's really important is to get those infection rates down. That's what will reduce deaths, it's what will reduce the pressure on hospitals, and it's what will prevent the long-term effects of COVID, such as long COVID. So the real key thing about the data is to emphasise the importance of all of us complying with the restrictions, driving the R below 1, and getting those infection rates down again.
Sophie, to your question on our future relationship with the EU, as you know, those talks are continuing. As the Prime Minister said, there is a deal to be done. But I think it's also important to emphasise is that whatever form of deal we end up with the European Union, there are going to be changes for businesses. And I have been writing, my department has been writing on a weekly basis to hundreds of thousands of businesses, making them aware of individual areas where they're going to have a look and see whether they're ready for the end of transition. So that may be in terms of custom clearances, it may be how they're looking to employ people who are currently working in the European Union, issues around work permits if they're going to go and work in the European Union. All of these issues I think businesses, of course, will want to address. And we've been holding webinars on a sector basis with businesses, very many thousands of businesses signing up for those, working with business representative organizations so they can cascade information down to the millions of members they have, and also proactively as a department, indeed across government, contacting and talking to businesses who need to get ready. And I want to thank all the businesses, the very many businesses across our country who are making every effort to make sure that they're ready for transition. And of course, we will continue to work with you, we will continue to support you, and make sure that post-transition we are also ready for the opportunities that will come. Thank you very much for that questions, Sophie. We now move to Dan Hewitt at ITV. Dan.
Thank you. A question, first of all, to the Business Secretary. On the day we again learnt the scale of the economic costs being caused by this pandemic, a number of your own Conservative MPs are very concerned on what's going on inside Number 10 following the resignation of Lee Kane, the PM's Director of Communications. Tory MP Sir Roger Gale says it's extraordinary and unacceptable that Downing Street should allow itself to be distracted by internal squabbles. What is your message to him and other concerned MPs? And a question, if I may, to Professor Powis. Do you regret stopping routine surgery too early in the first wave and resuming it too late? And will you apologise to those hundreds of thousands of people who are still waiting for treatment?
Dan, thank you for that question. I'll take the first one. So I can tell you that all of us in government are focused on one thing, which is protecting lives and protecting livelihoods. And I've set out some of the measures that we've taken in terms of extending the furlough scheme, protecting millions of jobs, extending the self-employment scheme, and that again, protecting so far 2.6 million jobs through that, and indeed all the grants and other support that we have provided. And we will continue to do that. That is what people watching this press conference, your viewers, will expect the government to do, to make sure that we are providing support for them and continue to put our arms around them at what is a really very, very difficult time for lots of businesses where people will be concerned and worried about their jobs, about their livelihoods, about their families. And it is right and proper that as a government we step forward and provide that support, and we will continue to do so. Steve, do you want to take the second question?
Yes, thank you, Dan. So of course, back in March, we were at the very start of this pandemic. We could see infection rates, hospitalizations rising incredibly rapidly, much more rapidly than they are in the autumn even. And of course, we could see around Europe as well, health systems coming under tremendous pressure. So Northern Italy was a good example from those high infection rates. Testing was more limited, so we had less information about exactly where the virus was. And for all those reasons, it was absolutely critical that we were able to create the capacity in the NHS to deal with that wave of infections, not knowing how large it was going to be, and in fact not knowing how the public would respond to the measures that were being put in place by the government. Of course, they responded magnificently, we know that. So it was right that we ensured that the NHS was ready for that. We had the capacity, of course we had the Nightingales on top. But of course, we don't want to step down elective surgery where at all possible. And indeed, that's why in the second wave this autumn, we haven't done that. We are keeping elective care going. Our clinicians have done a fantastic job over the summer, beginning to catch up. Cancer work is back where it was last year. There is more work to do. And of course, the key thing here is as infection rates rise and hospitals come under pressure, we've seen that in areas of the country with high community rates, then once again, there is a possibility that elective care gets affected. And our staff don't want that to happen. Our staff want to get on, treat people who are on waiting lists and to make sure that those waiting lists come down. And of course, you know, we're all sorry that people have been affected in this way. None of us as clinicians, none of us as managers want this to happen. We want to get on and treat people. The public can help us with this task. So it's the same message again, but it's absolutely true that if we collectively as the public, once again, as we did in the spring, keep to the guidance, drive down infection rates, then that is the best way to ensure that the NHS can do what it always does, which is to treat everybody with COVID, people who don't have COVID, ensure that those waiting times don't increase and that we can get on and manage the backlog. There isn't a clinician in the land that doesn't want to do that. We will absolutely do our best for our patients, and the public can help us by doing their best too.
Great, thanks, Steve. Thanks, Dan, for the question. We now go on to Sam Coates at Sky. Sam, hi.
Hello, Secretary of State. We've seen turbulence in Downing Street this week. Things seem fluid. Who should President-elect Joe Biden's Chief of Staff call in Downing Street if he has an urgent issue to discuss? And Professor Powis, would the UK's failure to strike a trade deal with the EU make any difference at all to the UK's ability to source coronavirus vaccine doses?
Sam, let me take that question from you. So the first thing I'd say to you is that, as you know, the Prime Minister has had a very positive call with President-elect Biden, and he's congratulated him, and of course congratulated the Vice President-elect, who, with her background and also the fact that she will be the first female Vice President of America, of course, has achieved something really quite historic. And the Prime Minister's talked about all the range of areas where we are able to work with the US, where we have our special relationships. One of those, of course, is climate, where the Biden team has said that they will rejoin the Paris Agreement. In terms of the focus of this government, as I've said to Dan Hewitt at ITV, our focus is singular. Our focus is on protecting lives and livelihoods, and we will continue to do that because that is what your viewers expect of us. Steve.
Yeah, so on the EU exit question, the NHS, of course, has been preparing for EU exit for some time, and we will continue to make sure that we are prepared for various changes. On the issue of procurement of vaccine, the Secretary of State of the government have been handling the procurement issue, so I might pass that back on the procurement issue. But as I've said earlier, our job in the NHS is to be ready to deploy the vaccine and frankly get it into people's arms and do that as quickly as we can, and that's what our focus is on at the moment.
Yeah. So I think, Sam, just on procurement to say that I think in really very fast pace, the Vaccines Task Force has secured 350 million vaccines across 6 of the most promising vaccine candidates. You've seen, as I said, the news that's come out about Pfizer-BioNTech, and of course, let's see what happens with the rest of the vaccine portfolio. We've got AstraZeneca, the Oxford AstraZeneca vaccine as well, which is in phase 3 trials. But we have some cautious hope now. But I think, as Professor Powis has said, is that we all still need to do the basics, which is observe the rules and the guidance. Thank you very much, Sam, for your question. We now go to Jane Merrick at the Eye. Jane, hi.
Hello, thank you. First of all, to the Secretary of State. Today, a new study by the London School of Hygiene and Tropical Medicine shows increasing public concern about a vaccine, partly due to misinformation campaigns by anti-vaxxers. 54% of people say they would definitely have a vaccine, and this has fallen from 60%. Do you accept that the government has a problem with its pandemic communication strategy, which is perhaps exemplified by the disarray inside Downing Street? And secondly, to Professor Powis, the REACT study today by Imperial shows that prevalence is still very high in the Northwest at the start of November. And of course, the Northwest were the places that had tier 3 from the middle of October. Do you think this shows that the tiering system wasn't enough to press down on those infections? Thank you.
Jane, thank you very much for that. So can I just say that, of course, it's been a very long 8 months since the start of this pandemic, and it's a global pandemic. It's something that's faced every single government across the world. And of course, as I said, our focus has been to get support to individuals, support to businesses, and we've done that. And you've seen, as a result of the work we've done in communicating this, we've made sure that lots and lots of businesses across the country have taken up that support. And in terms of vaccines, of course, I think it's very good news that we have around 300,000 people now participating in these trials. We will continue to communicate with people on the issue of vaccines. And then I think, as Professor Powis said, we will in due course set out the plan for deployment itself. So I think it's of course important that we continue to get the messages out, but I do think to this point we have managed to do that. Was there anything, Steve, you wanted to add?
On the question of tiering, so I'm confident that the tier system had an effect on the transmission of the virus and the number of infections in the community, and I'm sure that tier 3 had a greater effect than tier 1, that had a greater effect than tier 1. Of course, it's important to remember that tier 3 had a number of different ways in which that could be applied. But if you look in Liverpool, for example, I can certainly say from the NHS point of view, we are beginning to see some of the effects of tier 3, and we're beginning to see that the number of patients, for instance, in Liverpool University hospitals with COVID is now less than it was a week ago. We will not see the benefit to the NHS in terms of patients in hospital of the national restrictions that were put in place last Thursday until into next week, because there is a 2-week lag between people getting infected, developing symptoms and getting admitted to hospital. But some of the effects that we're seeing in Merseyside at the moment will have been the result of tier 3. But it's important that we don't just plateau at a high level. It's important that infection rates go down. So stabilising R around 1 is helpful, but it really needs to get below 1, and that is what the current national restrictions are designed to do. We will see over the course of the next weeks how that plays through, but as I say, in the Northwest, I think we are seeing some of the effects of the tier 3 measures that were put in place in Merseyside.
Great. Thank you so much, Jane, for your question. We now go to Mesa Hall at the Express. Mesa, hi.
Hello, thank you, Secretary of State. A question to you both about the hope for vaccine. Have there been any discussions within the government about the possibility of compulsory vaccination, as was used in this country against smallpox for many years? And what work has been done, if any, on creating a certification system to ensure that people can prove that they've had the jab?
Thank you, Mesa, for that question. So I think that the first issue, of course, is to make sure that we have vaccine doses which are safe and available. And we're absolutely clear that whilst the work on vaccines has gone at quite some pace, these vaccines will only be deployed if they are safe and the efficacy is there. As I said, the independent JCVI has actually sort of set out a tiering of who should get this vaccine first, and that is the process that we're going to follow going forward. So I think I don't want to sort of jump ahead here. I mean, I think the key thing first is that we need to get a vaccine. We need to make sure that it's got the efficacy that's required, it's safe, and then, of course, we will follow the advice that we get from the scientists and the experts.
Yeah, so yes, I think, as I said earlier, we are good at vaccination in this country. In fact, we have some of the highest vaccination rates in the world. Our flu vaccination program each winter vaccinates large proportion of the at-risk population. And this year, for instance, we are further ahead in terms of the proportion of at-risk people who've been vaccinated for flu than we were last year. So that gives me confidence that the public does have confidence in the vaccination program and will come forward for a vaccine to protect their health and protect others, as they are doing with flu this year. Flu vaccines, COVID vaccines, any vaccine goes through regulatory processes. It will not be deployed unless the relevant regulatory bodies are sure that it is effective and it is safe. That will occur this time round as it does every time round. But I'm confident that the British people will want to be vaccinated, that they will understand the benefits, not just for themselves, but for everybody, because it's by vaccinating, by getting high rates of vaccination, that we all protect each other.
Great. Thank you very much, Mason, for your question. The final question from the media comes from Emily Ashton at Bloomberg. Emily, hi.
Hello. My first question is to Professor Powis. Alok Sharma has just confirmed that lockdown will end when the regulations come to an end on December the 2nd. Do you think that is the right thing to do, given the rising cases, or do we need longer to get on top of this? And a question for the Secretary of State. It wasn't clear from your earlier answers. Can you categorically say that the supply of vaccine won't be affected by Brexit disruption?
So on the first point, clearly when we come out of lockdown in December, and of course that is quite rightly a matter for our elected representatives, we will not be going back completely to normal. There will need to be other measures in place because while this virus is still here, we need to ensure that infection rates stay as low as possible and that we reduce the chance of transmission. Exactly what those measures are, I think it's too early to say yet. We're only 1 week into this 4-week lockdown. We need to see what transpires over the next few weeks. And I'm sure as it comes up to early December, government, as will scientists, will be looking at the data over the weeks in November and then considering what the best menu of measures will be going into December. But ultimately, of course, that quite rightly is a decision for government.
Emily, thank you for that. Let me take your question on supply chains. Of course, this is an issue. I mean, you've talked about vaccines, but supply chains obviously is an issue across many sectors. But that is precisely why we have been investing hundreds of millions of pounds in terms of border infrastructure. We've been investing in grants for customs intermediaries. It's why we're making a very big effort to communicate with businesses to make sure that they are ready so they can get customs clearances done. All of that work is ongoing. If we all get prepared, we will be in absolutely the right place post-transition. But the key message that I want to leave for businesses is that whatever deal we end up in terms of our future relationship with the EU, there will be changes for business, and businesses do need to be prepared. So please have a look, go onto the websites, please have a look at the information that the business department, indeed other departments in the government are setting out to you, and we are there to help. So people need to get in contact with us, they should absolutely do so. Thank you very much, Emily. I think that brings us to the end of this press conference. Could I end by thanking everyone who is watching this press conference for absolutely everything they are doing to keep their families, their loved ones, and themselves safe throughout this process. And please observe the rules and guidance, hands, face, space. And I hope that if people do that, then we will beat this thing down and we will be coming out of the national restrictions on the 2nd of December. Thank you.